Well, good evening. Welcome to the Institute of Healthcare Management and the next in our fabulous Health Chat series, where this evening we have something really unique. We've got the marvellous Paul Devlin, who's part of the NHS Emergency Care Support Team, and we've got the sensational Steve Thomas, General Manager, wait for it, of the Radio Society of Great Britain. And they're going to tell us all about shortwave radio, how it's being used by the NHS and their huge army of enthusiasts around the country for the greater good. As always, we've got Roy Lilley in the facilitating seat. If you've got questions and so on that you'd like to ask as we go along, just put them in the Q&A section at the bottom of your screen, or if you want to use the chat facility. And after about 25 minutes, half an hour, I'll facilitate a Q&A. But for now, thank you very much, gentlemen, for doing this with us. Roy, over to you.
John, thank you very much, and good evening and welcome wherever you are watching this. If you're watching it live, it's great to see you. If you're watching recording, thank you for watching. Now, you know, when you go to an ordinary conference, there's always somebody late coming in at the back. And I don't know if you've noticed how they come in at the back, but there's never a seat at the back, is there? The spare seats are always at the front. So people come in and they look around at the back, and then they do the magic thing. They look down and they kind of tiptoe to the front of the room. Now, when they put their head down, of course, they think they're invisible, but everybody in the room watches them go to the front and sit down. So what we're doing now is allowing the people in the real world out there to come in, sit down, make themselves a brew or pour themselves a drink, get themselves organised, get their screen maximised so they can see everybody on the screen. I'm giving you a few minutes to wriggle your bum and get organised, and I think we'll make a start now, because if you're not ready by now, you never will be. So good evening to you all. Thank you for tuning in, and let's say a big welcome to Paul Devlin and to Steve Thomas. Gentlemen, good evening. How are you doing? You all right?
Yeah, absolutely fine, Roy. Thanks for inviting us on. Great to see you.
It's a great pleasure. And Paul, you're with the Emergency Care Improvement Support Unit. I imagine you've been fairly busy in the last 12 weeks.
Yeah, well, I think we all have, Roy, and it's lovely to see you. Thanks for the opportunity of tonight. Yeah, it is great to see you, and I think we've all been actively deployed and redeployed on COVID response and things. But it's all good stuff, and we're all adding value where we can.
Well, I'm pleased to see you're well. Anyway, that's the important thing. What have you been doing, Paul?
So personally, I've been supporting health economies to adopt a new way of responding to unscheduled care, and that's patients coming through treble 1 or 999 or GP practices. If they're not seriously ill or injured, then what we're doing is looking at how we can treat those patients as far as possible in their own homes or close to home. And we're calling it unscheduled care coordination, and I'm leading on that as part of the ESIST work at the moment and helping.
That's really interesting. We have to talk to you about that. I've read a statistic the other day that says a huge percentage of paramedic calls are just people are getting nowhere near hospital. The paramedics are sorting people out in the back of the van and taking them home, which I guess I'm wondering, you know, how much of that we're going to do when this is all over. Do you think it's sustainable?
I think we need to organise our services in a bit of a different way to make it sustainable, Roy. And I think we've seen a lot less people, as you know, wanting to go to hospital and calling the ambulance service. So rather than return to pre-COVID scenario where there was a lot of patients attending A&E departments that didn't need that service clinically, what we need to do now is make it far simpler for paramedics, GPs, community nursing teams to access their community services than it would be to do anything else. And I think if we can do that, we can sustain this.
Yeah. I've had a campaign most of my professional life in the NHS, and it's to make the hospital history. So perhaps we might finally get somewhere close to doing it. And Steve, you've got, let's have a look, you've got 3 million, I think, people worldwide that you can talk to through the Radio Society of Great Britain, 75,000 radio amateurs here. I mean, I'm interested to know, has sort of COVID been a topic of conversation when you've been on air?
Oh, absolutely, definitely, yeah. And the Radio Society of Great Britain represents those UK radio amateurs. And as I think you'll hear, or we'll talk about later, we run a campaign with Paul to try and help people through the situation. But generally, yes, there's 3 million radio amateurs around the world. And amateur radio is really it's a hobby for people who are interested in the technical aspects of radio communications, wireless communications. So we're the National Society for Radio Amateurs in the UK.
Yeah, I can't get over the fact there are 75,000 radio amateurs across the UK. Do they all have a license? They have to be licensed.
They do, absolutely. And the RSGB, we run the exams on behalf of Ofcom. So they all have to learn some technical skills. They take some exams, but there's 3 levels. So you can start nice and easy, then intermediate, and then the more advanced or the full license.
Yeah,
so
you've been doing the exams and what have you online. Have you during the COVID?
We have. That's one of the changes we made, because there are radio clubs that do training around the UK, but of course they haven't been able to do that, and they normally host the exams as well at their club meetings or at exam centres. So we've been doing online exams with remote invigilation, using video conferencing like this, so people can actually still get their licenses during this time. And we've seen a real big upsurge in people coming into it.
Really, that is interesting, isn't it? Do you think you're going to continue to do it online when all this is over?
We think we probably will. We also want the clubs to be involved again, but we've seen such an increase during this time that I think we'll try and maintain it. But
how do people, Paul? How do people get on air? I mean, have they got to buy a load of expensive kit, or is it fairly low cost? How's it done?
So, Roy, one of the things I love most about the hobby, and I'll go to Steve in a minute if I may, in terms of the technicalities of that, because he is he's obviously running the Radio Society of Great Britain. He is our specialist that we all turn to, and bless him for all his support with launching the NHS station. But no, one of the things I love most about the hobby is that it's incredibly diverse, and by that I mean you could have people that aren't employed, they might be in a low socioeconomical group, and they very simply can get on the air through a simple little handheld device, but using the global platform that is amateur radio to speak to people all over the world. And equally, if you happen to be incredibly successful with several £1,000s at your disposal to use the whole of the technology available, then yes, you can be talking to the International Space Station. You can be using specialist antenna systems to transmit frequencies, bounce them off the moon all over the country, use satellites. So the hobby is so diverse, it's fully inclusive, Roy. And it's,
I love the idea of talking to the International Space Station. So, Steve, what does entry level mean if I wanted to start up?
Well, we run a license called the foundation license, or foundation exam. So you can do that really easily. It's multiple choice questions. So there's a book, there's an exam syllabus. It's a basic understanding of radio principles. It's
right. and the kit. What is it? Paul was talking about a handheld kit. I mean, what's the cost of an entry level piece of kit roughly?
Oh, I mean, you could start with a radio for sort of £25–30 these days.
Really?
Yeah.
And where do you get it from? Because I mean, Maplins are closed now, aren't they? Without Maplins, I'm lost without Maplins.
There are amateur radio dealers around the country and online as well.
Yeah.
And of course, there's some of the equipment. Sorry, some of the equipment behind me is the higher end stuff. You know, you can spend as little or as much as you want.
Yeah, and it's really interesting. Now, Steve, you're at Bletchley Park, aren't you, this evening?
I am. Yeah.
Which is the home of the Radio Society of Great Britain, and you were kind enough to invite me for the launch of what we now lovingly know as Golf Bravo 2 November Hotel Sierra. So I've been practicing that to get that right, and that's the call sign for the NHS call sign. We'll talk about that in a minute. But Bletchley, of course, is a really interesting place. I mean, we all know it from the code breakers and the wonderful work they did during the war. But there's a lot more going on there now, Steve, isn't there?
Well, where I'm sitting now is the RSGB's National Radio Centre, which is at Bletchley Park. And here we allow people to, we encourage people to come and see amateur radio in action, learn about radio, and get to know a bit more about it, because a lot of people don't know that it's a technical hobby that's still very relevant in these days. So we had 97,000 people into the National Radio Centre here last year. We're closed at the moment, of course, which
Yeah.
means I can sit here and talk to you.
97,000 people. That's a hell of a lot of people, isn't it?
It is. So we're very proud to have introduced amateur radio to that many people last year.
Blimey, and if they all queued up social distancing, it would go from here to Bognor and back, wouldn't it?
It's a long
When
queue,
are you going to open up? Do you know?
No, not yet. We're waiting to see when Bletchley Park in general open. So
yeah.
Well,
It's, I mean, having been there and done it, if you're watching and thinking about going somewhere, for a day out when we can do it again, go to Bletchley Park and go and visit Steve and his colleagues, because it really is a very interesting place. They've got lots of older kit as well, haven't you? You've got
there's the whole history here, so you can see where radio started. And the RSGB itself has been going since 1913.
Yes. Do you know who started it? Because that was in the First World War, wasn't it?
Well, it started off as the London Wireless Society, I think, and then moved into being the Radio Society of Great Britain.
Yeah.
1913 anyway. So amateur radio itself has been around some time, but the important thing is that it moves with the technology. So now, as Paul was mentioning, people might be transmitting on microwave bands, very high frequencies. They might be bouncing signals off the moon. They might be doing amateur television. There is a whole world of technology, and amateur radio just moves with the times, and sometimes moves those technologies on as well. So wireless communications is absolutely all around us these days, isn't it?
Well, of course it is. And it was very interesting for me when I came over. I remember talking to some very surprised person on the other side of the world. But the interesting thing for them was the fact it was the NHS. And what struck me is the universal appeal and recognition of NHS.
Yeah.
Those three little words, National Health Service, NHS, people recognise it, don't they?
They absolutely do, yeah, and I think that's why Paul and I got together for the campaign. To be honest, isn't it, Paul? Yes. Good for radio, and definitely, hopefully, useful for the NHS as well.
Well, exactly. Well, let's go back to Paul, and we'll get on to your current campaign in a moment because it's really interesting. But just take us back to when you started. How you managed to get GB to NHS. Just take us back to that. I mean, I know the story is quite interesting. Just take us back to the beginning of the birth of Golf Bravo 2 November Hotel Sierra.
Oh, so Roy, where it actually got born out of is a request really from Professor Brian Dolan, who headed the End Pyjama Paralysis campaign, which it's a global campaign to encourage people who are in hospital to get up, get dressed and move about.
Yeah, just let me just interrupt you there. For those of you who don't know, Brian Dolan, you can pick him up on Twitter. He's actually from New Zealand, isn't he? Well, he's a Scot, I think. Was he a Scot? He's an Irishman, isn't he?
Yes.
Wonderful, soft-speaking voice. Came up with the idea of, well, the strapline was as End Pyjama Paralysis. The idea was to get people who were decommissioning, deconditioning, lying in bed, to get them up, get them dressed, and get them moving, which helped to get them home quicker. And it really it captured people's imagination, didn't it? Everywhere I went in hospitals, I saw this Brian's happy smiling face and these pyjama logos that he had. And he commutes backwards and forwards, I think, from New Zealand. He's in New Zealand now. Who knows? He could well be watching. I know. So it was a conversation between you and him, Paul, was it?
Yeah, and also my boss, Pete Gordon from ESIST. And the concept was that Pete and Brian wanted to, as they said, get the concept of End PJ paralysis into as many hands as possible. So people just understood the concept and appreciated the value of getting up, getting dressed and moving about and getting home quicker. And they said to me, have you got any ideas for how we can get this in the hands of the many, as they said? And I said, yeah, I do. I said, with 45%
Funny enough,
of the world's
I know 3 million people.
I know 3 million people. And, people forget, in our little technology bubble, that 45% of the world's population do not have access to internet or broadband or 3G, 4G SIM cards and stuff. And if you're the National Health Service wanting to be completely inclusive with your message, you've got to use radio communications, and that's why I pitched the case that we should support cascading that message of health and well-being to as many people that would listen to us by using the National Health Service station, and rather than just have it as a one-off, I just kind of applied to have a permanent special event station dedicated to helping the NHS spread health and wellbeing messages globally.
And you had to, it was a bit of a fight, wasn't it, to get that call sign, GB2 NHS?
Yeah, so actually, so we went for GB1 NHS. We've got GB2 NHS running as a special event station to support the Get on the Air to Care campaign. And there's a radio amateur who's actually been running a special campaign to try and talk to as many people about it and promote the campaign using GB2 NHS. And that's a temporary call sign. Our call sign is, I wanted Great Britain 1 NHS. So we are the kind of like the top call sign there, dedicated to the NHS. Now, when I approached our regulator, the Government Office for Communications, Ofcom, they just basically said it's a nice idea, but to be quite honest, we don't tend to do things like that, and we don't really have a precedent set.
I mean,
So,
you can imagine some bureaucrat sitting behind the plane.
And I thought that was the end of it. That was the end of it. They said, well, you can have a go and have a special event station for about 20 days, 28 days, but we wouldn't really look to be doing anything permanent about that. I said, well, is there anything we can do to ask the question? And they said, oh, yes, if you'd like to put in an application with a letter, we'll take it to what they called their standards committee, where, and Steve works with the standards committee, you know, all the time really, but the likes of me never even knew they existed. 3 weeks later, they came back, Roy, and they said, congratulations, we're going to issue you with GB1 NHS, but we're going to attach it to you, and therefore, if it comes into disrepute, we know where to go to. So I then thought, oh no, what have I done? And then I went quickly to get support from Steve.
I think I'm right, Steve, that there are some quite big penalties, aren't there, for the misuse of these call signs and the misuse of the airtime. So Paul can expect to be in Broadmoor, can he, for some time?
Paul would never misuse it, no, absolutely. And to be fair, during the campaign, Ofcom have been incredibly supportive as well, haven't they, Paul? So since we got started, then they've really helped. So it's been good.
Well, the background's really interesting. So right, okay, well let's get on to what we really are talking about tonight. And that is the campaign. So Get on Air to Care. Tell us, Paul, what was the aim of the campaign, and how did you go about it?
So how it came about, right? I'd always got an idea that we could use amateur radio to improve health and well-being in terms of like a little public service, if you like. Like Steve mentioned earlier, it's the science, it's getting your brain working, it's connecting with people you don't know across the world, it's constructing equipment. So there's a lot of kind of positivity around that in terms of your own emotional health and well-being. So that's always been one of the key objectives for me launching the National Health Service Station. But when we came on unprecedented times with COVID-19, I thought, well, we've got a golden opportunity here to really help people. So I came up with an idea called On the Air to Care. You know, GB1 NHS is an incredible brand because we've got the National Health Service there. But I just knew that we wouldn't get our campaign to fly unless we'd got the support of Steve and Heather Parsons and the Radio Society of Great Britain. Heather's the communications manager for the Radio Society of Great Britain. And between the three of us, we came up with the campaign, and the idea was to actually, Heather's idea was to have a call to action, which was Get on the Air to Care. And so I came with a bit of a, you know, half thought up idea with no real potential of going anywhere. It was a nice idea. And then Steve and Heather, then through the rest of the kind of colleagues in RSGB, turned it into something incredible. And we've got truly kind of national and international interest in the campaign now.
What did you think, Steve, when Paul turned up with his wacky idea?
We were trying to work out how we could make it happen, to be honest, because we were at the time, we were just moving all of the RSGB staff. We're based in Bedford, just down the road, and I was moving all of the staff to working from home. You remember how that all started? It was all happened in a bit of a rush. So we were right in the middle of that when Paul said, "What do you think?" And it sounded like a great opportunity, but it sounded like it was going to be a bit of a struggle. But we went for it. And our objectives really to start with was, Paul had obviously got the NHS objectives, And from our point of view, with the Radio Society of Great Britain, we wanted to show that we were supporting radio amateurs in the UK, and of course linking with the NHS and using both names of both organisations seems like a fantastic way of doing it.
And what was your content? What was the message really that you were trying to broadcast?
Well, what we really wanted to do was encourage radio amateurs to get on the radio and keep in contact with the people that they would normally keep in contact with, but with a little bit of remembering that people are socially isolated. Perhaps they can't go off to their radio club meetings that they normally do. So remember to get on the radio, keep in contact with everybody, maybe try a few extra things that they haven't done. As we said, amateur radio is such a broad hobby that you could do something different on every day and you'd still be learning something. You might be constructing, building your own radio. You might be trying Morse code for the first time. You might be trying satellite communications for the first time. So encouraging people to use the time when they're locked down at home to do something else seemed like a fantastic use of the campaign. And while reminding people that the NHS were doing such a fantastic job at the same time. Right? That I think, Paul, was about how we thought about it. Is that fair?
Yeah, absolutely, Steve. And I think, Roy, the only other thing around that is, thanks to yourself and John for tonight, and this is a key part of our plan as well, is to introduce the concept of amateur radio and how to get into the hobby to people that know nothing about it. It's promoting the awareness of the hobby, and it's promoting the benefits of being part of this community. And Steve did mention, all those visitors to the NRC, and Roy, as you know, we have our special events for the National Health Service where we can at the National Radio Centre at Bletchley. And that's because that is literally an international centre of excellence for radio communications. Every aspect of amateur radio is accessible through that centre. What's more, the volunteers that support Martin, that Steve mentioned earlier, the centre manager, their coordinator, they're really specialists in their knowledge. That's helpful for me because you could write my extensive knowledge of amateur radio on the back of a matchbox and still have room for your shopping list, really. But when I go to Bletchley, I'm surrounded by all these incredible specialist people with all the equipment. And, the last time we were down there, we were using satellites to get our message out, to talk about the importance about getting people out of their beds and out of their pajamas and dressed and walking about. I mean, that's just an incredible concept, but that's what you can get by getting into the hobby and getting down to the radio centre at Bletchley.
So your objectives were partly to get people involved in doing amateur radio for themselves. The ones that you were connecting to, what was their view? How did they take to the idea of the NHS talking to them?
Well, sorry, Paul.
Steve.
No, after you.
No, go ahead. You go first.
Go on, Steve. You go first.
I was going to say we allowed people to. Everybody's got a call sign when they get a license, and we spoke to Ofcom, and they said, well, if you'd like to, you could add /NHS to the end of your call sign during this period. So some people got behind that. They had some way of showing the support of the NHS, but a huge number of clubs have got together and done different things on the radio these days, and the campaign has just grown and grown. We put out obviously lots of press releases at the start, and it was picked up by the BBC. There's been radio interviews. We've been on there's been some coverage on TV, on the BBC News national website. But we've seen, as a result of that, I think hundreds of people coming into amateur radio during this last few months. So that's been really useful for us as well. So it's given radio amateurs a reminder to keep in contact with each other, a reminder that some of the amateur radio is still there and people are coming back to it who perhaps haven't been involved in it for a few years. We've seen a lot of that, and we're attracting new people as well, all during the lockdown situation, and giving people the opportunity to recognise the NHS at the same time.
Well, I think it's an amazing achievement. And if you're watching us live tonight, I'm sorry if you're watching a recording, but if you're watching us live, you've got a question that you want to ask Steve or Paul, please do. No question is too stupid, because I don't know anything about this either. So we're here on a journey of discovery, or if you've got a comment, that'd be it'll be great to hear from you. So how many people, Paul, do you think we've been able to, I mean, there are 500 affiliated clubs around the UK. I think God knows what it is on a worldwide basis. How many people do you think you've contacted?
Gosh, Steve, I don't know if you've got any idea around stats and things. So contacting people in terms of being on the air, I mean, that's really tricky to get a handle on. And I know in terms of reach of our campaign, Heather, our RSGB communications manager, has been monitoring social media. We've encouraged people to use the Get on the Air to Care hashtag. So we've been monitoring that as well, haven't we, Steve, to try and track people's...
We have, and we know the media campaign itself has reached a phenomenal number of people. We're still counting it, but it's still continuing. So we're still having, we are very grateful for this invitation today. We're still taking, media requests. I think we've put out our own requests to our own members to say, tell us your stories about what you're doing. And we've had a huge number of those in, and some great ones from youngsters that have got involved. And also,
tell us about them. Give us some idea of the stories from the youngsters.
Okay, well, we've got one from a young lady called, I just got to read, Anne-Marie, who's 11 years old, down in Cornwall. And she's been arranging on-air meetings for other people in Cornwall on the radio and coordinating that herself at 11 years old. And she sent us in, she's been interviewed on BBC Radio as well. Yeah. We put out an appeal. We run a magazine. I'm gonna have to wave it at you. Sorry. We publish a magazine for our members every month. There we go, Radcom. And you can see on the front cover there the logo, and then all of the pictures that people were sending in of all of the things they were doing during the lockdown time. And there's one on there. I know there's a friend of mine just holding his very young baby, and he's looking after the baby because his wife, who's a GP, was out helping other GPs at that time. So he was on the radio with the baby and thought that's an ideal opportunity to support the campaign.
Left holding the baby.
We have hundreds of those stories. It's really good.
Yeah. And Paul, have you got any recollections of interesting stories and people you've spoken to?
I think there's one funny story. Right, anytime we go on the air, we don't necessarily need to publicise it amongst the radio communications community that much. But anytime we go on the air with the NHS call sign GB1 Nhs, we always have a lot of people end up waiting to just come and talk to us, really, basically because it's like it's almost like a little kind of radio operator thing that if you can operate a rare call sign or a particular special call sign, it's just a nice thing to be able to do rather than just talk to your mate up the road. You can do that anytime. And
people, I know the community want to claim that they've had that contact as well.
They do.
Because they keep a record of their contacts. Yeah.
And word gets around, we are the only government level organisation in the country to use amateur radio as part of our normal business, in the way that other big organisations may have clubs for their staff out of hours, but they don't use it as part of their normal business. So that's a bit of a kind of a big thing for the radio communications community. And we end up with a lot of people waiting to talk to us. And very often I'll say, we'll be on the air for 2 hours and then we're going to have a 30-minute break or something. And somebody even emailed me saying, even the NHS amateur radio station has a waiting list.
So, that's priceless, isn't it? Yeah,
that's priceless. But a couple of really lovely stories we've had over the last 12 months, really, not just with the campaign, but it reinforces what we're doing with Get on the Air to Care. As there were two gentlemen who wanted to get their amateur radio license. And one of our key priorities as well is through the campaign, is to reduce loneliness and isolation. And these two gentlemen, through physical disability and mental health conditions, were basically housebound and couldn't engage with communities in the way that you or I would, or attend a club to get trained up or whatever. So the local radio clubs actually rallied round for me and arranged through RSGB and other colleagues to allow those individuals to take their exam at home. This was before Steve started up the remote exam process, but to go and support those people to make sure that they were knowledgeable enough to take the test, and then to facilitate them taking the test, and then support them getting some equipment set up. And the one story I'll always remember is that the Stafford and District Amateur Radio Society member went up, their trainer actually went into this one gentleman locally in Staffordshire, and he took his multiple choice exam and whatever. And when he informed that he'd actually passed his exam, so he can actually say, well, you know, it looks like you've passed your exam. I can't confirm that until it's been, you know, invigilated on, but it looks like you've completed your exam successfully. The gentleman burst into tears. Now he's now in contact with people all over the world from his living room, because he's gone through that process. And I think we can do a lot more of that to support, you know, positive mental health and emotional well-being.
Well, that's a lovely story, because I mean, there's no question about it that, you know, the damage that COVID has done in destroying families and deaths, and I mean, there really aren't any words to say how vicious this has been. But of course there is the aftermath of this, of people who've been in lockdown, you know, whose mental health has suffered, who haven't coped well with isolation. I imagine that Steve, this kind of contact has been a lifesaver.
I would imagine so. I'd certainly like to agree with Paul that you know, some people who are housebound normally then rely on amateur radio for outside contact. So that's kind of what gave us the idea for this. But it's about the social isolation, but about trying something different as well, just to keep the mind active. Certainly no expert in those sort of areas, but I do know that people have relied on amateur radio for outside contact, you know, in some cases. It
would be really terrific if we could have sort of more of the inside thoughts of people who have been using amateur radio during the lockdown, and what it's meant to them, talking to people around the world. I mean, as I mentioned at the beginning, you know, when I was over with you, when I was just blown away by the power of the words NHS on radio communication. And people, I remember this guy said to me, "Are you really the NHS?" You know, and I said, "Well, yeah, I am actually." All of it, it's me. With the NHS call sign. And I think Simon Stevens, or Sir Simon Stevens as he is now, who's the chief executive of the NHS, when we met him, Paul, he was quite surprised as well, wasn't he?
Yeah, and thank you for that, because we're aware that you know, Sir Simon, bless him, he can't really get into promoting or supporting individual things. But thank you to you, Roy. I'm in no doubt whatsoever. We had that wonderful photo of him holding up the GB1 NHS call sign.
We did thrust a great bit of cardboard with the logo in front of him. And he said, "What's this?" I said, "No, my son, smile. It's the NHS." And he dutifully smiled, which was
yeah.
John,
I'm absolutely sure nobody else except you could have done that, though, Roy.
He can't give me the sack, can he? John, how are we doing? I know we got some interest. Do you want to draw together some threads?
Yeah, it's a little quiet, but if you've got questions, do please send them in now through the Q&A facility. But I'll start off, if I may. Could you just tell us, how do people get involved with the hobby and GB1 NHS if they just want to start? How do they do that? Is there a website, or is there a phone number, or how do they do it? With social media, tell us, please.
Paul, mine?
Yeah, go for it, Steve.
Okay. All right. So the RSGB's website, rsgb.org, is the place to go to. And you can see there details of how you get started, how you study, and how you take the exams. That is the very simplest, easiest way to find out.
Fantastic.
Paul, I don't know, do you want to say anything about GB1 NHS at that point?
Well, he's the only one with that call sign, isn't it? You can only use that. Yeah.
Absolutely.
Yeah. If anybody wants to get in touch and you know, have a discussion about why we're using amateur radio for the NHS and how we use it, please go to gb1nhs.uk and click our contact details, and you can come straight through to me on email, or use @GB1 NHS on Twitter, and I can pick that account up as well.
Yeah, you have a good following on Twitter. Well, guys, Steve, I think first of all we need to thank you, Steve, for having the courage to give us NHS 1 or GB Golf Bravo 1 November Hotel Sierra in the first place. That was a visionary bit of foresight. Well done, Paul, I think, for having the idea in the first place and make it happen. And well done, as well, Steve, for the way you've adapted and innovated to cope with the requirements of lockdown and making it easier for people to pass their exams and participate. And thank you both for having the vision of involving people who are in lockdown. And, we can only imagine what a lonely experience that can be for some people. And we hope that they've found new friends around the world that they never knew existed. I think it was, you launched, I think, on World Amateur Radio Day, didn't you, back on the 18th of April. And it really is an innovative global community. So thank you both. So if you want to get in touch with the Radio Society of Great Britain, just tell us again, Steve, the website address is
rsgb.org.
And Paul, you'll get in touch with Paul there by clicking the email contact. So, gentlemen, thank you both.
Thank you, Roy.
It's a great pleasure. I must see if I can.
We just got one more question. It's just come in from Tim. Sorry to interrupt you, Rob. Tim's just come in with a question just quickly. Does GB1 NHS have a regular national network?
No, we don't have a regular scheduled network at the moment. It is something, actually, I've had a couple of people mention that. So it is going to be something that we look to put on just to give people an opportunity to wear the call sign. And personally, for me to get the call sign on the air more, really. So we predominantly focused on special events so far, but I think just a regular scheduled net to try and encourage people to kind of take part in the hobby. And also what I'd like to do is just to encourage other organisations to see the value of using amateur radio at an organisational level. And that includes people like the BBC and the police force and the emergency services nationally, not just to have it as a sideline for their colleagues as such, but to embrace it as part of their core offer, core business as usual, like we've done with the NHS.
I think, John, we got another question. We're just about to close.
Yeah, I just answered actually. It's what age range are radio amateurs? Is this something that interests young people too? And I've taken your example of the 11-year-old hosting a sort of a discussion. So yes, it does, I guess, is the answer.
Yeah. There's people of all ages that come into it. Some people come into it early and they drop away from it and they come back to it later. It's one of those hobbies that can stay with you through life because it changes as technology changes.
Great. So your task, Paul, is to get a regular network broadcast going.
Will do.
I'm going to see if I can pass the entrance exam, and then I might invest 25 quid to see who I can talk to.
We'll hold you to that, Roy, and John.
Yes, we'll have a new company asset. It'll be a shortwave radio communicator. Listen, it's been a really fascinating half an hour talking to you guys. I had no idea. I think any of us did we? That the nooks and crannies of the NHS are so interesting to explore. So thank you for what you've done. Thank you for what you're going to do. And I'm going to say good night and hand you back now to John. I think he's going to tell us about what our next event is. I think it's tomorrow night, isn't it? We're on air tomorrow night.
Yeah, we've got Jason Helgeson from the United States talking about the United States approach to COVID and the response they've had and comparing it with the US. He's a previous medical director of New York and Wisconsin, I think, originally. So that's tomorrow evening at 5 o'clock. Do please tune in. We then have our...
Can I just say, John, just to interrupt you, I've interviewed him before when he was over here. He's in New York tomorrow night, and I'll be here in London. But he is a really interesting guy and a terrific talker, very high-level operator in healthcare in the US. and he's actually been very critical of the US response to COVID. And there are some parallels of what they've done there and what we've done here. So he's a guy not to miss. So if you can tune in for that, it'll be terrific. Sorry.
Sage advice from Roy there. And then we have our first ever Institute of Healthcare Management virtual conference on Thursday afternoon. And the topic, carbon reduction. So if you're interested in carbon reduction, environmental sustainability, how it affects health, social care, etc., do get involved. It's free to register, and we've got some fantastic speakers lined up. And then on Wednesday, June the 24th, we have Professor Rebecca Mulby talking about her experience and advice around 10 things that we should now seek to preserve in the wake of COVID-19.
There should be 11 things, because it's shortwave radio and Golf Bravo 2 November Hotel Sierra. Right. Sorry, John.
So that's that for us this evening. I do hope you've enjoyed yourselves. As ever with the IHM, we are expanding our content and value for money for members all of the time. If you want to find out more, please go to ihm.org.uk, and we have a free membership offer. If you want to join the IHM and experience the online content that we have, it's free till the end of July. So do register now. All that remains to me to say thank you, Steve. Thank you, Paul. Thank you, Roy. We've really enjoyed it this evening. I am also going to go online and get involved in this. So thank you all. And if you've been watching at home, we'll see you soon. Thank you very much. Good night.
Thank you, John. Thanks, Roy. Thank you.